Over 65 and wondering why stubborn belly fat feels impossible to lose. What if the real solution is not walking more or eating less? For decades, doctors believed fat gain after retirement was inevitable. But modern aging science tells a calmer and more hopeful story, drawing from geriatric medicine, exercise physiology, and longevity research. Researchers now understand that belly fat is deeply tied to muscle signals, especially after the age of 65. Loss of muscle quietly changes how the body stores fat. This is not about willpower or discipline, it is about biology. Visceral fat around the waist is different from other fat. It interferes with blood sugar balance, it stresses the heart, it increases inflammation, and it accelerates loss of independence. Many seniors follow common advice that sounds reasonable: walk more, do gentle cardio, avoid strength work. But this advice is incomplete. Walking is valuable for the heart and mood, but it does very little to preserve muscle signals. Without those signals, the body keeps storing belly fat even on fewer calories. This is why many older adults feel discouraged. They are doing what they were told, yet their waistline does not respond. Here is the overlooked truth: after 65, the body responds best to targeted muscle activation. Not long workouts, not exhaustion, but specific controlled movement. Large clinical reviews from institutions like the National Institute on Aging confirm this. Short bouts of resistance-based movement change hormonal messaging. They improve insulin sensitivity, they reduce visceral fat, and they do it safely. The number one exercise is not fast. It is not complex, and it can be done at home. It is the sit-to-stand movement, also called the chair squat. This single movement activates the largest muscles in the body: the thighs, the hips, and the core stabilizers. These muscles act like metabolic engines. When they fire, the body shifts into fat-burning mode even hours later. This is why results appear within weeks, not because calories are burned, but because muscle tells fat what to do. Studies from Harvard and Mayo Clinic show improved waist measurements in older adults with simple lower body resistance done consistently. No gym required, no floor work, no strain on joints. The movement is controlled: feet flat, chest upright, slow lowering, gentle standing. This is safe for knees when done correctly, safer than stairs, safer than jogging. The quiet fear many seniors carry is falling, losing balance, or triggering pain. This exercise directly trains balance and confidence. Each repetition reinforces stability, nerve pathways strengthen, reaction time improves. This is not about pushing through pain, it is about teaching the body trust again. By now the idea should feel reassuring. There is no need to fight your body. Aging bodies respond to clear, simple signals. The chair-based sit-to-stand sends one of the strongest signals possible. It says we still need muscle. It says we still value balance. It says we are preparing for tomorrow. Many seniors believe belly fat is purely a diet issue, but research shows muscle inactivity is the bigger driver, especially after retirement. Less standing, less rising, less loading of the legs. The body adapts by storing fat centrally. This is survival biology. The good news is that biology adapts quickly when movement returns, not intense movement, but meaningful movement. Doctors often see improvements in patients who cannot walk far, but who practice sit-to-stand daily. Their glucose markers improve, their waist measurements shrink, their confidence increases. This is why this exercise is often prescribed first, not last. Another overlooked factor is breathing. Slow exhalation during standing activates the parasympathetic nervous system. This calms stress responses. Lower stress supports fat loss, especially in the abdomen. Never hold the breath. Breathing is part of the exercise. The nervous system learns safety. This is essential for older adults. Safety drives consistency. Consistency drives results. You may wonder about machines or weights. Those can help later, but they are not required. Body weight is enough to activate muscle fibers, especially when movement is slow. Slower movement increases muscle engagement without increasing joint stress. This is ideal for aging joints. Some people worrying they are too old to start. Research on adults in their 70s and 80s shows improvement. Age does not block adaptation. Inactivity does. The body is responsive when invited gently. If pain exists, consult a medical professional. Adjust range of motion. Use higher chairs. Support yourself. Progress is individual. There is no comparison. Another reason this exercise works is hormonal response. Lower body resistance increases growth hormone signaling. This supports fat metabolism and tissue repair. Even small increases matter. This response declines with age, but does not disappear, it simply needs stimulation. The chair squat provides that stimulus safely. Over time. Posture improves, a stronger core supports the spine, back discomfort often decreases. This allows more movement throughout the day. More movement reinforces the cycle. This is positive momentum. Many seniors notice better digestion, improved bowel regularity, and warmer hands and feet. These are signs of improved circulation, all connected to muscle activation. Belly fat reduction is not isolated, it reflects whole body improvement. The goal is not appearance, it is resilience. When illness occurs, those with better muscle reserves recover faster, they maintain independence longer. This exercise builds reserve quietly, consistently at home. If you combine this with adequate protein, hydration, and regular sleep, results strengthen. But even alone, it makes a difference. This is empowering because it places control back in daily routine, not in complicated programs, not in fear, just a chair and a few calm minutes. Think of this as brushing your teeth, small daily protection that prevents bigger problems later. As weeks pass, you may choose to add light weights or increase repetitions. But there is no requirement. Maintenance is success. Doctors define healthy aging as maintaining function, not chasing youth. This movement aligns perfectly with that definition. It supports standing, walking, reaching, and reacting. These are life skills. Belly fat reduction becomes a side effect, not the sole focus. That mindset reduces stress, and stress reduction further supports fat loss. Everything connects as you continue. Pay attention to how daily tasks feel: getting out of bed, rising from chairs, climbing steps. These improvements are meaningful, they signal protection of freedom. This is the real outcome. The body does not need punishment, it needs clarity. Sit, stand, breathe, repeat. That is enough, that is effective, and that is supported by science. Independence is built quietly, one calm movement at a time. Did you know one of the best exercises for losing stubborn belly fat can be done right in your living room, using just a chair? It's the chair squat, and it's a game changer for repairing your metabolism. But here's where most people go wrong. They focus on doing too many reps. The secret isn't intensity, it's quality and consistency. All you need are 5 to 10 slow, controlled repetitions, just once or twice a day. That's it. Why does this work? Because consistency sends a powerful signal to your body. After about 2 weeks, your muscle cells become more sensitive, your blood sugar control improves, and your energy levels feel much steadier. Around the 30-day mark, you might notice your waist feels a bit softer, and your pants fit differently. This isn't about rapid weight loss. It's about deep metabolic repair, and safety is key. Always use a sturdy chair, hold onto the armrests if you need to, and breathe steadily. Stop before you feel fatigued. This simple movement mimics everyday actions like getting up from a sofa or out of a car, which helps protect your independence as you age. Now, here's a surprise. The second most important factor for reducing belly fat and diet, it's your sleep timing. Poor sleep spikes cortisol, the stress hormone that tells your body to store fat, especially around your middle. When you combine chair squats with an earlier, consistent bedtime, the results are amplified. This powerful duo lowers stress, supports muscle repair, and helps calm down those pesky appetite signals. Of course, nutrition still matters. A modest increase in protein helps support your muscles, but without the activation from an exercise like the chair squat, protein alone won't do much. This is why the chair squat is so effective. It works with your body's natural biology, not against it. As the weeks go by, you'll feel more confident and less fearful of movement. Every single repetition is a message to your body that you still need strength, balance, and control. This approach is powerful because it's simple. You can easily integrate it into your day in the morning, before lunch, or while watching TV. Spreading out your reps actually improves results and is easier on your joints. Another amazing benefit is improved circulation. The muscle contractions in your lower body act like a pump, improving blood flow back to the heart. This can reduce swelling in your legs and means better nutrient delivery and waste removal, which further supports your metabolism. It's not about chasing youth. It's about protecting your freedom. Thanks for watching. If you found this helpful, please give it a like and subscribe for more tips on staying strong and healthy.